All right, man, I got something to address with you all. Especially this one goes out to all the guys that are crushing it in the gym 5-6 days a week, putting in gains, seeing that progress. Good for you. But the question I have is, are you doing the back end work to maintain your body? You're running your body like a race car right now, and that's totally cool. But you're gonna have to come in for a pit stop once in a while. And those pit stops, you're gonna want those to be under your control, not under, the guidance of some higher power saying they're going to pull you down for a pit stop, meaning unforeseen health issues. As much as working out is a beautiful thing, like anything that can be done a lot, there are some side effects of working out. One thing that I've experienced, and some of the guys that I've talked to know this, is it's a high red blood cell count, also known as your hemoglobin. If your hemoglobin gets too high, it doesn't have anywhere to go. It just stays in you, and it's thick. It's like having thick, sludgy oil pumping through your car's engine. Not good. And you can't just do anything or take a supplement to make it any better. So you got to figure that shit out. How do you figure that out? It's pretty simple, actually. You book yourself in for a blood donation at the Canadian Red Cross, Canadian Blood Services, and they'll take out half a liter. This is what I call your pit stop under your control. Must be done, not optional. This is how you remain good health and do all the things that you want to do. The reason this happens is you're breathing a lot of oxygen when you work out. You are possibly doing some cardio. There's going to be a lot of oxygen in your blood. And combine that with some iron, some vitamin C, and the processes of your bone marrow, it's a perfect breeding ground for more red blood cells, okay? So if you're feeling symptoms of you're tired, you're lethargic, you maybe don't feel as strong, maybe you're getting persistent headaches, maybe you're getting chest pains, maybe you're getting stroke-like symptoms. Those are some of the extremes, but there's some signs that you're going to want to watch out for. Anything even remotely close to that, book yourself into the Red Cross and Canadian Blood Services and get yourself taken care of. They're going to give you back a report that's going to have your hemoglobin number on it, and you're going to want to keep that, I usually say, around 140, 150. If it starts to get too high, the 170s, even dare 180s, even worse 190s, you're in big trouble. You don't have much time to deal with that. At that point, you're going to have to see a doctor. So without seeing a doctor, this is how you can manage your blood on your own without any doctor supervision, because this is a normal thing. If you ask enough buddies around the gym, healthier guys, you're going to run into this. It's not uncommon. It's just not talked about a lot because it's just not, nobody likes talking about maintenance. Everybody wants to talk about that new way to arm curl or that dumb new way to flex your chest, whatever. Those are the fun things. This is the serious talk. Take my words of wisdom, very important, because what can happen is this thing's not going to treat you lightly. If your blood gets thick and you don't deal with it, one day you're going to wake up and shit's going to be very broken. You could have a stroke. You could have a brain aneurysm. You could have a blood clot that gets pumped through your heart and gets stuck, and that's where you're going to have a heart attack. You don't have to be old to have this happen. You can have this happen in your 30s, your 40s. It happens to all kinds of guys. There's no real way to tell if it's going to happen to you. The best way to deal with it is to watch for the signs, or worst case, if you're at all concerned about what I'm talking about, book that appointment at the Canadian Blood Services and you'll find out, because they'll give you a report of what your numbers are. Thanks for listening, guys. Have a great week.